Another day, another test. And today's test is looking for gestational diabetes. So in gestational diabetes, what we're looking for is how well your body processes sugar. And if this is something that is coming up for the first time in pregnancy, is it really because of the pregnancy, or is it because there are some underlying issues and maybe you're already developing type 2 diabetes? And risk factors are not the same across the board. In fact, even the American College of OBGYNs doesn't recommend everyone be screened for gestational diabetes. Now, in practice, that's not what happens. In practice, everyone gets screened. But at least they acknowledge that not everyone is at the same risk. And we look at the same risk factors that you might have for diabetes in general. Are you a higher BMI? Do you have a family history of diabetes? And as far as your obstetric history, do you have a history of unexplained stillbirth or of a large baby? Maybe we want to look at how your body is processing sugar this time around. And why would that even be an issue? Well, for a true diabetic, and if you're really having difficulty processing sugar, your baby's going to get too much sugar. And yes, they can become larger, and that can lead to more intervention at birth. But the other thing that happens is as a newborn, they're so dependent on that blood sugar that they're having difficulty processing sugar on their own. And it can be a rough transition for them into life. So what are some ways that we can prevent this from happening? I'll link this book in the description, but this is an excellent resource. And this author, Lily Nichols, has an excellent track record of walking women through gestational diabetes and helping them to manage that without insulin, or even with insulin, but with better diet choices. And her main focus is on whole foods. I would classify her basic recommendations as on the paleo end of the scale, mainly focusing on whole foods, no processed, and getting as fresh as possible. So how does this test even work? If you do the regular screening, it is at the end of the second or early third trimester, and you're given a small bottle of liquid that has exactly 50 grams of glucose in it. And you have to drink it very quickly, and then 1 hour later, you do a blood draw, and then you measure your blood sugar. And it's a pass-fail. There's a cutoff, and if you're above it, you fail. If you're below it, you pass. One of the problems with tests that are on a spectrum like that is the spectrum itself. If you're really, really low, it's really easy to say, okay, sure, you pass, no gestational diabetes. If you're really, really high, it's easy to say, all right, we know for sure you're going to need some extra help. What do you do with all those numbers in the middle? What if you pass or fail by just a few numbers? What does that mean? There's more judgment call in that. So we need to look at all of the factors going into this. Do you have any other symptoms that your body's not handling blood sugar well? Are you thirsty all the time and not gaining any satisfaction from the things that you're drinking? If we look at your urine dipsticks, are we seeing both sugar and ketones in there? There are other things that we need to look at. And ultimately, the answer is still, what are you putting in your body? So those are the things to think about, and not everyone needs to have this test. One of the few things I agreed on with ACOG and the recommendation that you look at all the risk factors and decide women who are at a lower risk don't need to take this test. So let's look at all of your risk factors, and as we're doing all along, we're going to look at what you're putting in your body. What are you eating, and how is your body handling that? That is more informational than a one-time glucose challenge, I think. So let's talk about gestational diabetes and how it may or may not affect your pregnancy.